Hello everyone! Today's controversial issue we'll be presenting is about drug resistance and communicable diseases. Do you think we can win? This is Rahul. He's been coughing for a few days and decided to take some medicine he found at home. The first few sets of medication did not work, so he decided to keep taking all the medication he could find at home in hopes that one would work. However, he felt worse and decided to go to the hospital. Now we wouldn't want you to end up like Rahul, would we? So what exactly is drug resistance? Drug resistance is when the medication is losing its effectiveness to treat the disease or infection due to the overuse or misuse of that drug. In the beginning, we developed drugs to fight against communicable diseases and infections. This increased our chances of survival and life expectancy. However, as the years progressed, the drugs started to lose their fighting prowess and lost their effectiveness because they became resistant to the drugs. The first antimicrobial drug was used to treat syphilis in 1910. In 1928, Alexander Fleming discovered penicillin. After 20 years, penicillin-resistant staphylococcus became a global pandemic. To combat this, methicillin antibiotics were invented in 1959. Not too long after, the first strains of MRSA began to emerge. In 2017, scientists developed a new class of antibiotics to potentially destroy superbugs. But how did this happen? First, we have an alteration in the receptors preventing drugs from binding. This is caused by the microbe changing the receptors so that the drugs cannot recognize and bind to them. Next, we have enhanced destruction or inactivation of the drug caused by an increased amount of enzyme degradation. Now we move on to the synthesis of resistant metabolic pathways. Here, microorganisms like bacteria develop another route to become resistant to the drug. The drug is no longer effective due to the alternate path. Lastly, we have reduced influx or increased efflux of the drug so that more drugs leave the cells, decreasing the amount within. One of the reasons why we are seeing different mechanisms of resistance is due to the excessive use and misuse of drugs such as antibiotics. Over the past decade or so, resistance has evolved among the various classes of drugs in different countries, such as Hungary, India, Norway, Belarus, Greece, and Thailand. What are we doing about drug resistance? So far, we have set up infection prevention and control measures, create awareness and surveillance programs, as well as antibiotic stewardship programs. We are currently trying various methods to combat drug resistance, many of which are strategies that we have already been using in the past. A few preventative measures individuals can work on include proper personal hygiene, like washing your hands often and avoiding contact with sick individuals. In addition to this, you should always be up to date with your vaccines. You should also be preparing your food in a hygienic manner. This can be done by keeping yourself and your ingredients clean, separating your raw food from your cooked food to prevent cross-contamination, cooking your food thoroughly, storing food at a safe temperature, and using foods that were produced without antibiotics. Another strategy being used to combat drug resistance is improving awareness. By improving awareness and the understanding of drug resistance, we can educate the public on how to safely and responsibly use antibiotics when they are needed to lower the chance of its misuse. In fact, there's even a World Antibiotic Awareness Week that takes place annually every November. The World Health Organization's Global Antimicrobial Surveillance System, also known as GLASS, includes 52 countries, including 25 high-income, 20 middle-income, and 7 low-income countries, which reveals the widespread occurrence of antibiotic resistance among 500,000 people with a suspected bacterial infections across 22 countries. Drug combination therapy is a short-term strategy where multiple drugs can be used to suppress the growth of bacteria and prevent the bacteria from mutating into drug-resistant forms. Now for drug strategies in healthcare. Drug resistance is a big problem in the healthcare sector, and many different measures are taken to minimize it. One key strategy being used is physicians only prescribing antibiotics when a patient actually needs them. In the past, antibiotics were widely prescribed even when they were not needed. For example, sometimes an antibiotic was prescribed to a patient even though they had a viral infection. Patients are thoroughly educated on how to responsibly use antibiotics and how to prevent future infections by being vaccinated and practicing proper hygiene. Global impact. In the US alone, there are over 2 million cases of antimicrobial resistance per year. Every year, there are more than 700,000 deaths worldwide from AMR, with about 50,000 deaths per year in Europe and US alone. Tuberculosis accounts for 1/3 of deaths caused by AMR. By 2050, the number of AMR-related deaths is expected to reach 10 million. Available evidence suggests that the problem with drug resistance is much worse in developing countries. The impact of drug resistance is heavily felt upon middle and low-income regions. Developing regions are mostly affected due to the increased consumption of non-prescribed, low-quality medications. Social impacts. Drug resistance brings about fear of consuming drugs. If we don't take prescribed medication when necessary, it can increase the severity of illnesses. There is also a growing fear of eating foods that do not carry the organic or antibiotic-free label. Because of drug resistance awareness programs and surveillance, research in any new antibiotic discoveries has significantly declined. According to CDC, drug resistance costs Americans up to $55 billion per year. In low-income countries, drug resistance increases healthcare costs as much as 25%. Antibiotic resistance adds $20 billion in excess direct costs in the US. By 2050, drug resistance will cost the global economy up to 3.5% of GDP, which means it will cost the world 60 to 100 trillion USD if not tackled. For more information on how to adhere to and follow safe and proper antimicrobial use, visit www.antimicrobialstewardship.com. We believe that if everyone adheres to these guidelines using antibiotics responsibly, while healthcare and research professionals continue to develop new strategies, the battle against drug resistance can be won. Thank you for watching. We hope you enjoyed.